Let me welcome you to our first session of the teaching program that's actually supported by Mindray, Cairo, and Cairo Medical. This is the first lecture. My name is Ahmed Zakria. I'm a consultant fetal medicine, specialist in the field, and actually I chose a topic which I hope would be interesting, where I'm going to be addressing how we can actually get into multiplanar imaging and 3D and 4D ultrasound imaging. And my main objective really with the lecture is to teach you how to actually set a target and learn how to reach that target and get a good image into it. And we need to appreciate a few points, is that when we're doing 3D and real-time 3D imaging, we're not taking a single slice, we're taking a group of slices of images, and what we're doing is actually first doing a group of data acquisition, where we will have to define a good target and get a good 2D image, because that's your keystone into getting your volume 3D imaging. The second step is to do the image or the data pre-processing, the reconstruction of the image that you have obtained by the computer available in your ultrasound machine, and then displaying your final image. And in that, we have to actually choose the proper rendering tool that we're going to be addressing, because your proper rendering tool is actually the main cornerstone of having your image. So after the data are obtained, the volume reconstruction is implemented by using two procedures. One is called interpolation and the approximation algorithm to get the 3D volume data and put them into a volume grid-based or spatial information acquired for your tracking system. And with that, what we do is you're actually putting all your slices together, and your computer is actually doing a multiplanar reformatting to get you the volume of data close to each other. And actually with each slice, what the computer does is it actually tries to find the exact location of that object on the image and apply it to the next point in the next slice and apply it to the next point in the next slice. So when you're actually taking a multiplanar view, the structures are not always straight line, they can be curved, and with the 3D and the image rendering, what you can do is you can actually correct for that, and the machine can help you into actually putting all the slices together to get the real acquisition of what's happening in real time. The next step as well is that once you have the information, you can actually work again on two structures. First is, can I actually work on the surface? Do I really need to work on a maximum intensity where I can get more of the solid structures as bones, or when I want to go on a very soft intensity of imaging to get mainly the blood vessels? Again, I can actually render all the slices together and see how the structures look like from the surface, or render how the blood vessels with the soft structures from the inside look like what I'm showing here in those two images of the heart. When we actually address the 3D imaging, we have to appreciate that we're sending images in three different planes. Plane which is the coronal, sagittal, and longitudinal planes, what we call the A plane, B plane, and C plane. And we have to appreciate that there is a point of junction between those three planes. That point of junction is what appears on your images as a point in the reference image. And when you have that point, you can actually move across the different parts of the volume to get more of understanding or more of appreciation into the different areas of the volume. So you can actually move closer to the surface, you can move away from the surface, you can actually rotate across that point when you actually set it into your target of interest. And let me go through different points in that. For instance, if you're doing an acquisition of a volume of the heart, you know that the three planes that you have actually applied will have a junction point, and you actually use that reference plane, and you can actually move the point across the different structures of the heart so you can see them in all the views. For instance, here we have different analysis. The first analysis in the imaging is what we call surface imaging, where you actually put your volume of 3D parallel to the target of interest, and that volume, that camera of the 3D will actually take all the slices across the surface, and you can actually render all those slices into an image. And this is what we get at the end in a surface imaging of any volume that you obtain. So you need to set up your target. For instance, here I've set up my target to be the profile, okay, and I've got the surface rendering to take all the slices together so I can see the profile. I can do that with any of the structures that I want, for instance the spine, the limbs, and I'm going to show that when we work with the live demo in the second part of my session. Again, if I wanted to move across that volume, we have this point that we described earlier, which is the junction between the three planes, the A plane, the B plane, and the C plane, okay? And if I set that target to any point that I want, I can actually see it in the three reference images. So I'm here seeing it in a longitudinal section, I can see it in the coronal section, or in the sagittal section. Again, if I set that point and I wanted to render that surface, then I can actually see the different structures on the surface, and by moving that target point by the three planes, by moving the buttons across the X plane, the Y plane, or the Z plane, I can actually rotate across the surface that I've seen. So I can move the baby from one direction to the other, I can flip it from up down, I can move it from right to left, and accordingly I can get better visualization of the target that I want. Again, when we do the rendering sections, we actually utilize that reference image that we have with the magnitude of the three planes together, so I can actually move across it. So if I rotate it from one side to the end, I can actually move the baby, instead of looking downwards to look upwards, or I can rotate it from the right to the left, and I can see across it. So I could see the fingers, for instance, on this point here, I can see them from the inner aspect of the fingers, I can see from the nostrils because they were facing downwards, I can see the ears, I can rotate across them, I can even come a bit closer and zoom up on them. Not only that, because we already have the three planes that we've been checking, the A, B, C plane, which is the longitudinal, sagittal, and coronal, with the development of the technology, we can actually see them live by working on two planes together as two live images, what we call biplane imaging. So for instance, if you're seeing the heart in the 4-chamber view, you can actually see it as well in a sagittal view, all live, moving at the same time. This is what we call biplane imaging. As well, you can actually add another addition, so you can actually work with color Doppler, so you can see how the image looks like. For instance, this is the arch of the aorta with the branch of the aorta coming out. You can see it in a 2D plane, and you can actually apply color Doppler and see it live all together. Again, biplane imaging, so I can get a sagittal image, or I can get a coronal image, both with, and add to it a color Doppler view, so I can see how the structures and how the tissues look like in two planes with color Doppler just at the same time. Not only that, we then developed a different approach, which is how can you actually look into the different structures and use the utility of the 3D volume of group of data together. So for instance, when we wanted to look at the bones, we can actually choose a different rendering modes according to whether we are using imaging for bones or vessels or cystic structures. So we can use the maximum mode for seeing bones, and in that mode, as you can see here all the vertebrae, you can actually count them, you can see the processes, you can actually count the ribs. You can actually use a minimum mode where you actually mainly focus on soft tissue structures and mainly for blood vessels. You can actually see a minimum mode image of the liver where you can actually see the division of the portal vessels across the liver. Or you can see an X-ray mode where you actually dampen the hard tissue and you can actually see all the surface soft tissue structures across it. This is just a model of how we can use. You can actually use a surface model where you can see the surface of the baby. If you use a maximum mode, you'll be seeing the bones. If you want to use the X-ray mode, you'll only be seeing all the soft tissue without seeing the bony part of it. With the inversion mode, what happens is you actually can change the insonation, and instead of having the soft tissue to be the black part and the solid tissue to be the more of the echogenic part, you can actually invert that. So for instance, this is a baby who have hydrocephalus, and you can actually see that we have actually dilated the the cystic structures that have the fluid, which are the ventricles, and you can actually see them quite clearly. And you can use this inversion mode in different other examples. So instead of seeing the stomach as being black, you can actually see it as the echogenic structure, and you dampen all the other tissues around it. For instance, this is the stomach here, where you can see double bubble sign and duodenal atresia, and you can actually see that's the stomach, that's the dilated pylorus, and that's where the obstruction is. If you apply this inversion mode again on vessels, you can actually draw the vessels. So you can actually see, for instance, this is the heart, and you can see the ascending aorta giving the branches and going down across the baby's body. And in that part, you can actually invert the structures. So you can take all the soft tissue structures around it, and you can actually see the heart with all the vessels coming out and giving all the branches. Not only that, you can apply it to any tissue that actually has fluid content, and one of the good examples of that is follicle tracking in ovarian stimulation, because we know that the follicles are filled with fluid. So if you take a volume of the whole ovary and you actually invert the volume of the 3D, you can actually draw each single follicle individually, and as well there is a software system that can actually measure the two mean diameters of that follicles, and it can give you a record of how many follicles are there and what the average size is, and it can give a different color for each size, so you can actually appreciate the number of follicles that you're seeing. So now we've actually worked on two modalities of the 3D imaging. The first modality was the surface rendering, where you can actually see structures on the surface, okay? Or we worked on a multiplanar modality like what we're doing here. And then we worked on inverting the quality of what we're seeing, so we can actually invert the structures, comparing the cystic and the solid structures together, so you can actually draw them a bit clearer. Again, we can use the different modes. So we can use the maximum mode, as I said, to see the solid bones. So you can see all the vertebrae from top downwards. You can see all the structures of the skull. You can see that the fontanelles are open to diagnose cases with craniosynostosis, for instance. Or you can actually move the surface rendering modes to apply structures on the surface. So you can see face, spine, limbs, and all those solid structures. And they're sometimes very close or very unique in the sense that they really mimic the reality. Can you actually change those rendering modes? Of course, because you already have the solid data there. So once you have the volume of the structure that you've obtained well on 2D image, which is what I'm going to explain later while we do the live demo, you can actually change it into, for instance, a maximum mode, and in that you can see all the bony structures. You can see the spine, you can see the vertebrae, you can see the skull, you can see the fontanelles, and you can actually define them clearly here. Not only that, the second advance was, can you actually apply imaging and use a volume of color Doppler slices together and see how the structures look like? And this is what we call glass body imaging, where you can actually take a group of color Doppler slices together, and you can actually draw the network of the blood vessels going across it. It can sometimes be helpful in defining structures of placentas or areas when you want to see how much vascularity is there. And not only that, by using the color Doppler volume imaging, you can actually obtain some indices of the amount of vascularity going to those tissues, like what we call vascularization index or flow vascularization index, which can give you an impact or an input into how much vascularity is there, for instance, in tumors, in placentas, or in areas where you're suspecting invasive placenta. Again, you can actually use that volume imaging into actually obtaining a thicker slice, and not just taking a single slice of what the standard 2D probe can do. So you can actually take a thicker slice, you can apply the color Doppler to it, and obtain a volume of moving structures. For instance, the heart, sometimes thicker slices are more appreciated, for instance, to check for septal defects. Or you can actually take a real-time image of all the slices of the heart close together in what we call spatiotemporal image correlation, because the heart is a dynamic structure, it's pulsating all the time, it's moving all the time. So you can actually take one cardiac cycle and then sweep across that cardiac cycle and see the different sections you see in the heart. Again, you can see different modalities of what we call volume imaging, where you can actually, instead of taking one slice, you can actually adjust your scanning system to take a thicker slice. For instance, here I want to check for the corpus callosum of the fetal brain, and if I take more than one slice and put it all together, then I'm taking a thicker slice of the corpus callosum, and you can actually appreciate how the corpus callosum looks like with more of a thicker slice of imaging. Again, the same applies to the heart. You can actually quite appreciate the septums, the valves, the foramen ovale, and the entrance of the pulmonary veins. Not only that, simply because you have the ability to actually move across the volume that you obtained, you can actually curve the line of interest of the 3D imaging, as I mentioned at the start of the analysis. So you can actually get all the dots close together and draw a curved structure. And one of the commonest curved structures we want to check is always the spine. So you can actually curve the plane or the line of the 3D, so you can actually obtain the shape of the whole spine and you don't miss parts of it. You can even increase the thickness of the slices of the 3D, so you can actually get the whole spine together. And not only that, because you already have the image of the 3D or the volume of the 3D, you can actually apply it to any structure. For instance, assessments of the fetal brain on the fetal skull, and you can actually cut those sections and spread them all together next to each other in slices according to the thickness you define. And using that, you can actually see the structure of the whole brain, similar to what we see in computerized imaging in CT scans, when you can get all the slices next to each other and you can actually analyze them and see them. So you can actually see the corpus callosum, the crossing fibers, you can see the lateral ventricles, and even move across that structure from top downwards, so you can see the ventral structures of the corpus callosum or the connecting fibers of the cerebellum at the back, and you can see the midline structures, which is the difficult part that you cannot always appreciate with 2D imaging, and that's one of the advantages that the 3D can offer of getting more closer look at midline structures. Again, as I mentioned, so now I have a volume of overview of the brain. I can move across that volume ventrally or backwards. I can move across all the midline structures. You can see all the midline structures of the fetal brain, from the corpus callosum, the fibers that cross across the cerebellum. You can see the lateral ventricles. So actually, you can move all over the place across the volume ventrally, backwards, and sidewards. Again here, if I move across the back part of the brain, I can actually see the cerebellum in all the sections. So I have the volume, I can actually rotate around it and move in different structures. What about the fetal face? Well, we have two nice new advances. One of them is obviously the realistic visualization of the face, where, as you can see in the technologies that's available there, that's actually very close to the reality. And again, what we have is actually having a flexible line of 3D that actually is there all the time, so it moves as the baby moves, so you can actually keep the image going in a very realistic way. That's actually quite nice for the parents, as you all know. So it's a matter of actually getting what we call, again, a flexible 3D, where you can actually have the volume there, and then you decide, well, I'm going to take a cut across this aspect here. So this aspect represents the lips, you can see it there. I'm going to take a cut across that aspect there, which represents the palate, and you can see this yellow line here is the palate. Or I would say I'm going to take an aspect across this line there, where it actually represents the soft tissue structures across the top of the palate. So you can actually move and cut across the volume of the 3D and see what the render of these knives that you use look like. For instance, here across the brain, if I cut this way, then I'm actually checking for the corpus callosum. If I cut that way, it's there, the corpus callosum is there. If I cut across the brainstem, then I'm actually seeing the thalami and the brainstem. So I can then move across the different areas of the volume and decide what I want to do. Or move again and move across the different structures of the surface. Again, we can combine a thicker slice of 3D along with volume 3D imaging to get better visualization of the branches of vessels as they go and distribute across the tissues. Here, with a colored Doppler and a thicker slice, you can actually see the structures of the vessels moving all across the corpus callosum and going all the way across it and giving all the branches, so you can actually define it quite clearly. Or you can actually see the structures of the placenta root, and the placental bed, and how the vessels go across it. You can see the different areas of the cord, define the cord insertion, and appreciate a little bit more about it. And in those images, what we do is actually we magnify the tissues of the soft tissue, and we dampen the structures around it, so you can actually show the vessels a bit more clearer. And here you can actually see all the vascular tree across the placentas, particularly with cases of abnormally high vascularity in the placenta and cases of invasive placenty. You can actually move across different sections of the heart by doing color Dopplers. You can actually see how the different structures of the heart. Here you can see the pulmonary veins as they go into the atria. You can see the interventricular septum, the blood flow across the heart in a thicker slice, which is actually quite helpful when you want to check for different defects and ventricular septal defects. Here you can actually see it in color Doppler as live. So you can see here on the left side, you can see the branches of the pulmonary vessels as they're going in, and you can see the vena cavas as they're going up into the right side. Again, you can see the different branches of the vessels as they go out of the heart and divide across the abdomen, and you can see the ductus venosus quite clearly in a thicker slice. Okay, thank you for your attention. We're going to take a few minutes of a break so that we set up the live demo. And in the live demo, I'm going to show you how we're going to move across the volumes, how we're going to obtain sweeps across the baby, how we're going to adjust that, and accordingly take it from that point onwards. I'll meet you again in a few minutes. This is not actually a very good way to get the standard views. So what I'm going to show you in the live hands-on session is to show you how to first get the standard views and how we're going to utilize this into getting the views we're going to be using in 3D, and how we're going to be working with the 3D with the multi-planar modes and with the surface rendering to show you how we can actually get the best information while we're doing the fetal anatomy survey. So the first part of it is I'm putting the probe at a 90 degrees angle. I'm going to do a little bit of a tilt towards the patient's thighs, and what I'm seeing on the screen, as you can see here, is I could see the mother's bladder, and I could see her cervix. And in that view, I can actually start by putting the color Doppler, and I'm going to be moving the probe, as you can see on my right hand, sideways, so I can see the uterine vessels. As you can see here, I can see the uterine vessels coming from the bottom upwards, and I'm going to be putting a pulsive Doppler and getting a wave for the uterine. So that's my first part. I can then sweep again toward the left side with color Doppler on, so I can find the left uterine vessels. As you can see them here, and I'm going to put pulsive Doppler again on it and update. And I can get another wave for the uterine vessels on that side, and I can measure. The next move is to actually move towards the baby, and I'm going to be moving the probe, still touching the patient abdomen at a 90 degrees angle, and I first of all will find where the placental location is. So as you can see here, it's a fundal placenta, I will divide the mother's abdomen into 4 quadrants. One on the top left side, so I move from the midline, still the probe touching the abdomen at a 90 degrees angle, and I find the deepest vertical pool of amniotic fluid. Again, I'll do it on the right hand side and find the deepest vertical pool of amniotic fluid to measure. And then I'm going to go below the umbilicus and move to the bottom pocket. So I'm going to move to the left lower pocket when I can measure the amniotic fluid. Obviously, I'll try to avoid where the cord is and the limbs, and again on the right hand side. And then I have 4 decent pockets of amniotic fluid to measure if I want to be doing that. The next step for us would be to actually get a fetal biometry survey. So the best starting point from my perspective is always to find the baby's head. So I'm going to move the probe across the patient's abdomen until I find the baby's head, and at that point, when I find the midline echo of the fetal brain, I always move my probe at a 90 degrees angle to try and get a view where I can get the bioparietal head circumference. The baby is actually facing upwards, so I'm going to utilize that for now, because I might not be able to get it again before we do the biometry, and I'm going to do some of the 3D of the surface rendering. As we explained in the lecture, when we do surface rendering, we're actually doing 3D to get information on the surface. It's a quick acquisition of volume. It doesn't take a lot of time. It's actually just giving you information on the surface of the baby without going through the base of the baby. So I'm going to get a view of the baby's face. In order to do that, the best thing to do is put the probe longitudinal, find where the midline echo of the brain, which is this structure here. I'm going to move my hand until I get the midline facing straight upwards, and then I'm going to sweep my probe at 90 degrees, and that's when I can get a profile. So put the probe longitudinal, find where the midline is, move your hand until you get the midline to face straight up, and then if I sweep 90 degrees angle, I'm going to get a fetal profile. I'm going to get it in the middle of the screen. I'm going to try and adjust so that I can get a bit of zoom so it's more in the center. I'm going to reduce my gain so I can get a decent view so it's not too bright or too dark. And then I'm going to put my 4D window on it. And as you can see in the 4D window, we have the camera line, which is this line here. I'm going to get this camera line to be as parallel to the target as possible. And I'm going to reduce the window to take just the object of interest, which is, as you can see here, the fetal face and the profile. And if I update the image, I'm going to flip it because it's facing, baby's facing downwards. You can see, I could see here the nose, the mouth, the eyes. What I can do is take the reference image, which is this one here, and you can actually move close to it because you can see there is a limb in front of the baby's face. So I'm going to move my 4D image while my scanning hand is fixed, so I can actually get a bit closer to the face. I can see the eyes, I can see the nose, the mouth, the chin. And then what I can do is actually move using the 3 axes that I have. So I have the x-axis moving the baby this way. You can see from this reference image. I have the y-axis. I can flip the baby around. And I have the z-axis, so I can actually move the baby from down upwards. So I can actually get a view, so I can see below the chin, or here I can see from the top of the nose. Okay? Or I can move the baby around in that direction, or facing downwards, so I can get the baby to face upwards, or face downwards. You can see the baby's hands in front, or I can flip it around so it faces me, or faces to the side. And I can see the ears here. Okay, so this is the easiest way of getting an image of 4D, which is the surface rendering. Let's do some surface rendering on any target we want. So, as we mentioned in the surface rendering, we'll only be getting surface information, quite quick to achieve and quite easy to do. So, the second easiest way of getting surface rendering is actually looking at the baby's gender. So, the first point is I'm going to put the probe longitudinal, touching the abdomen at a 90 degrees angle. I'll find the midline echo of the baby's brain. I will rotate the probe at a 90 degrees angle, keeping my thumb on the right hand side so I can see on the frame here that the right is right, so my orientation is correct. And then I'm going to slide across the baby's abdomen. I can see here the heart, stomach, And then below here I can see the baby's bladder. Okay? And between the legs, if I flip again at a 90 degrees angle, I can actually get the gender. So I can actually look at the gender by surface rendering. So if I put 3D, 4D and apply it here, you can actually see clearly that it's a male. You can actually see it here. You can actually move around it. So I can get it to sweep that up, sweep down, this way, that way. I can rotate it from any direction I want. And you can actually see the gender quite clearly. Okay, so that's one point. Let's actually do some surface rendering on other structures. But before we do that, let's have a way of actually handling and sweeping across the baby's body so you can actually get the views. And the best way to do is, first of all, put your probe 90 degrees angle, move upwards until you find midline echo of the baby's brain. As you can see it here, that's the midline echo. I'm going to move my hand at a 90 degrees angle, so instead of scanning longitudinal, I'm going to be scanning transverse. And in that view, I can see the structures of the baby's brain. So I can see here the skull, the cavum septum pellucidum, midline echo. I can see the two thalami, and as well I can see the lateral ventricle of the baby's brain. So if I want to get the face from that view, the best thing to do is to get this midline to face straight upwards. So I'm going to move my hand across the whole abdomen of the mother to try and get this midline, so as if I'm moving across her complete waist, to try and get the midline to face upwards. Sorry, the baby has moved. Let's do it again. So put the probe longitudinal, see the midline echo, move 90 degrees, and then I'm going to move across the mother's abdomen to try and get the face to face upwards, as you can see here. Obviously, you're always working against a moving target, so the best thing to do is to go back to your starting point. So again, if I can't get it, so put the probe longitudinal, see where the midline echo of the brain is, move 90 degrees angle, so we're getting a view of the baby's skull. I'm going to sweep across the whole baby's body now, so I'm going to see below that the fetal neck, and then below it I'm going to be seeing the view of the chest where I can see 4 chambers of the heart and the 2 lungs. Below it I'm going to be seeing the stomach, and if I keep sweeping down I will see the iliac bone, and if I rotate my probe at a 90 degrees angle, then I will be seeing the femur. So that's the easiest way to get the fetal biometry. So put your probe longitudinal again, see where the midline echo is, rotate 90 degrees, you'll be getting a biparietal head circumference. If you do a gentle probe at the back part, you'll be seeing the cerebellum, as you can see here. If you sweep across the baby's body, still with the probe touching the abdomen at a 90 degrees angle, you'll see the 4 chambers of the heart. If you keep sweeping downwards, you'll see the stomach. Below it, you'll see the cord insertion. If you keep sweeping down, you'll see the iliac bone. Once you see the iliac bone, rotate your probe 90 degrees, and you will get the femur. So let's do a little bit of more surface rendering before we go through multiplanar imaging, as I explained in my lecture. So if we're doing more of surface rendering, let's have a look, for instance, at the fetal abdomen or the fetal spine. So over here you can see, if I put the probe longitudinal and I keep it longitudinal, then I could see the face. If I keep going down, then I could see the fetal limbs, as you can see them here. If I want to see the limbs, I can actually put my 4D parallel to my target, because as we mentioned here, we're doing just the surface rendering. And then I can update my image and see the limbs. So over here you can see the ankles, both legs crossed, because I'm parallel to them here. If I get a bit closer, and I will see him more closer, I'm getting a bit closer with my camera, but let's do it again. Maybe has moved. So I'll come parallel to my target, so that's my leg and foot here. You can see the angle of the foot. If I put my 3D and 4D parallel to it, then I'll get a view of the angle of the ankle. And I'm going to update it now. Can you see the angle of the ankle? And you can see the toes here. Okay. Let's do a bit more. Let's get actually the spine. So we've seen face, we've seen gender, we've seen limbs. Let's try and get the hands. So the hands are usually on the side of the body. So if you get a view of how the baby is laying, so I'm moving the probe as I mentioned with an angle always touching the mother's skin at a 90 degrees angle, and I slide it from the top downwards, and I move to the side of the baby where I could see the hands. You can see the hand here on the side. So I'm now parallel to the spine. Let me try and get a better grip of it again. So I'm now, okay, baby's moving. So baby is helping me now with getting the spine a bit upwards as it was starting to face down. So I can put my real-time 3D parallel to the spine and get a surface image of the spine. So you can see a surface image of the back of the baby here. Okay. With that, we can actually work with the different modes we have into actually checking bones. So we can actually go into a maximum mode where we can actually see the vertebrae, as you can see here. We can go to a surface mode where you can actually see the covering skin. And because the baby spine is actually tilted in that image and then have to move it, so I will rotate it so it actually corrects on your rendered image. So you can see my parallel line is parallel to the spine. I can come a bit closer or I can go further if I need to. So with that, I'm actually utilizing all the modes because you're actually using a surface mode to see the surface skin with soft tissue. You can actually work with maximum mode to see bones, minimum mode to see soft tissue, X-ray mode to ignore all of that and see just the whole soft tissue structures, or the eye live, as you can see here. So you actually have to decide what facility and or what utility of the 3D you want to use while actually applying it. Now we've actually looked into utilizing the surface modes into surface structures as the main interest. We now can move into actually looking into multi-planar imaging, where you can actually get a view of any structure and move around it. So you can actually get a better and a closer utilization of the 3D images you have. For instance, here I have the brain, okay, and I have all the structures of the brain. I can see the lateral ventricles, I can see the cerebellum, but I actually cannot see well the midline structures, and that's actually one of the big utilities that you can use with 3D. So what we're going to do now is actually use static 3D and not just real-time 3D or 4D. So we're going to be using static 3D and taking a volume of this fetal brain. So I'm just asking the mother to actually stop breathing because she's moving the image quite a lot. And I'm going to take a volume of the baby's head. So now I have a volume of the baby's head. I'm not going to be using surface rendering anymore, but I'm going to be going inside and using what we call multi-planar imaging. And with that, I know that I have the 3 reference images, the A, B, and C image, and I can actually move across all the structures. And we know, when we described in the lecture, that the junction of the 3 planes that we use in the 3D is this point here, and this is our point of interest. So I can actually move across this point of interest to see what I want. So if I want to see the anterior structures of the brain, and I get close, I can actually see here the eyes. If I keep going back across the midline, then I can see more of the fetal brain. And if I keep going back toward the posterior fossa of the brain, then I can actually see the cerebellum and the other structures here. So let's move a bit more and adjust our image. And as you can see here, you can see the peduncles of the cerebellum. If I want to focus on the midline, I can actually see here the fibers of the corpus callosum. So by using the multiplanar way, I've been able to actually modify and my slices where I'm actually cutting across the baby and accordingly see different structures that I could not have obtained in a single 2D image like this one by taking a sweep and taking a volume of images and moving across them. So I can actually move across the whole brain and do all the analysis of all the structures of the brain from the anterior aspect, seeing up to the eyes, across the corpus callosum, and the posterior aspect, seeing the peduncles and the peduncles of the cerebellum and the midline structures of the posterior fossa. Okay, let's do one more example of multiplanar imaging, for instance, across the baby's stomach, for instance. So let's take a view of that. So I'm going to be taking a 3D image of the baby's stomach. And I'm going to show you how I'm going to utilize that.
So now I've taken a multiplanar image of that. So in that view, you can actually see the different structures. We can see the stomach in the A plane, and you can actually see in the coronal section, you can see the junction between the heart and chest and the abdomen. And in the sagittal section, you can actually see the spine on the back, and you can see the kidneys on the side. So we can actually move across those structures to come a bit closer to the surface or a bit closer to the kidneys. So if you move this way, for instance, I'm coming very close to the surface where I can actually see the cord insertion at one point. If I go backwards, then I'm moving across the abdomen. Here, I'm actually seeing the liver, which is what I'm actually scanning with my point of interest. If I want to go towards the stomach, I can actually see the stomach, and it's on the left side below the heart. If I go back to the midline, and I keep sweeping backwards, I'm actually seeing the terminal ends of the ribs, which are in the back here, what you see in the abdominal circumference. And if I keep going downwards toward the spine, then definitely the back part of the spine and the kidneys will be seen. So this was just a simple demonstration of how we can actually utilize the 3D on either surface structures or on multiplanar structures, or we can use different modes like inversion mode, maximum mode, or soft tissue mode, so I can see more of the bones or more of the soft tissue structures. Let's do one final sweep across the baby's body again. So always put your probe longitudinal, see where the midline echo of the brain is. Move 90 degrees angle with the probe touching the abdomen, still at 90 degrees. You can actually see the biparietal head circumference or the brain structures. If you sweep across the baby's body, you'll see heart. Below the heart, you'll see stomach, cord insertion. And when you see the iliac bone, you can rotate 90 degrees and see the femur. Again, if you want to see the face, okay, put your probe longitudinal, see where the midline echo of the brain, rotate 90 degrees, and then with this midline structure here, move your probe across the whole maternal abdomen to get the midline to face straight upwards, and with that you can see the eyes are facing upwards. If I rotate my probe in that view at a 90 degrees angle to it, then I would see the profile, and I can then apply my window of surface rendering parallel to that, and I can then see a good view of the baby's face. And I thank you all for your attention.